password.
Still.
Yeah, I still need the password.
123456. Yep, that's the old one. 171421. I don't know who they thought I was.
Diet on the rocks, Mr. Dept?
Yes, on the rocks. That's exactly where they said our season was 5 weeks ago.
The Bills over the last month have lost 3 of their last 4 games.
You know, it doesn't matter what you want to do. It's gotten down to a point of what you have to do if you want to make the playoffs.
Did they really think we were going to roll over and die after a few tough losses?
They had us for that, baby. We ain't dying yet.
Fires to the end zone, and it is caught. Touchdown, Bills. What a drive. Let's go!
Is this our year? Hell, I don't know, but I like our chances.
1, 2, 3, 1, 2, 2.
We got a quarterback that can will victory.
Yeah, 17.
And a defense that won't quit.
It's sacked. He is dropped.
We got a clutch kicker and a punter, but we might even need the punter.
Josh Allen going to keep it himself. First down, Buffalo. I didn't see that one coming. I didn't see that one coming at all.
We're still kings of the East, but no crowns yet. Playoffs are where true legends are made.
Intercepted. He may go all the way. Touchdown!
Ain't nobody wanting to come to Buffalo in January. But believe me, things are heating up around here. Which leaves me with one question.
I know. Where else would you rather be?
Actually, I was just wondering if somebody had a light.
Right here? Right now.
Y'all love Bills Mafia. Look at this environment, man. Finish, baby, finish. God, gets me going, man.
Unfinished business.
Unfinished business.
Playoff bow, check it out.
This is nice. I think I'm going to keep this.
Well, good afternoon, everyone, and welcome to our block chat. I just thought that we get everything started off in a good way. We know what's happening this weekend. It's about the Buffalo Bills. Can we get to say, hey? Okay. Listen, we have Buffalo Bills fever in Buffalo, and if you don't know anything about the Buffalo Bills, we'll pull you to the side and we'll let you know. Again, I just want to thank everyone for our block chat. My name is Oswaldo Mestri. You can see I'm the city's director of citizen services. I am decked out in Buffalo gear here. I got Mr. Diggs' number here. And again, just thank you for everybody for coming in. We just wanted to, as we let people in, usually I play a song or two, but I just thought it'd be appropriate, to make sure that we are willing our Buffalo Bills to win and take it all the way. Again, this is good to see everybody and hear everybody at our weekly block chat, as we always have done. Can't say enough, and thank the Buffalo Border Block Clubs for help sponsoring and putting this block chat on as we do. We have a great topic today. It's a relevant topic. It's something that many of you, we still have questions on. We're dealing with the pandemic and the coronavirus, and more specifically with this new variant. And so we have the opportunity of just hearing from the experts, and you guys have requested this. And so we're going to do a presentation on not just the pandemic, but the coronavirus, and again, all of the things that are associated with that. And then we'll do a question and answer period. I always talk about the opportunity to be informed is within your hands, and it's very important. We want to make sure that we get information out to you. We all know people that have been affected. Some of you, I'm looking here, are coronavirus survivors, and I'm glad to see you on this side. But there are some that this disease have unfortunately taking their lives, right? And we want to be mindful about that too. Last week, I heard a good friend, and actually the mayor's friend and roommate passed away. You know, we are praying for his family in that respect. Many of you know him, Ron Brown. So listen, it's important for us to make sure that we are not just being mindful of ourselves, right? But we are being mindful of each other. This variant is contagious. It carries from one person to another. That's why we tell people to mask up to the extent that they can, to make sure that they have protection in terms of getting the booster or getting the shots, in that respect too. So we're going to get the A and all of the stuff to know more about what's happening with that. I'm just excited about that too. I know a week and a half ago, the city, through the county, we received testing kits. And so we we worked with a couple of community centers in the city of Buffalo. We passed those out. I know the Board of Ed is passing those out, and we're going to hear some other announcements later on where we can get that. We're expecting another shipment in. And so to the extent that we're going to reach out to community-based and organizations to make sure that they get out kits, we're going to partner up with the Buffalo Board of Block Clubs to do something very special. We're still kind of putting that in the works and making sure that these testing kits get in the hands of individuals. And I will say adequate, in terms of this policy, in terms of how to use this. Don't get the kit and open it up and use it. You should have symptoms, so you should be symptomatic. I mean, you should have that. You should, not because you was with somebody who was exposed. You want to make sure that you use that kit, in the timely fashion that we do. So listen, thank you very much. I can't not talk about this, not say to people to say, listen, Buffalo, thank you. There's a lot of great things that are happening out there in the community. We had a snow event that hit Buffalo extremely hard, to the extent that people are still digging out, and the resiliency of individuals in Buffalo is second to none, in terms of helping out. In fact, we've had in our office, individuals, senior citizens, handicapped and disabled, have called 311 and we've tried to assist. And I want to say a big shout out to those organizations that are part of our network, our Good Neighbors Network in that respect too. We have organizations like CEO and the GYC Ministries and other organizations and people who have volunteered. And so we will hand them off to working with, some of our most vulnerable residents in that respect too. People who need to get medicine or oxygen, or you have our senior citizens that may not have the means. And so I'm not out there advertising it. I'm just of the opinion service knows no gratuity. Gratuity is just in the service of this helping. And so that's what we do. And I think everyone does that. That's the Buffalo way, right? You're driving around, you see somebody stuck, you get out, you help push, you give them the wink and a nod, and you go do it, and you hope somebody else does that too. And so we've been doing that. Again, I just want to thank all of those folks in that respect too. So I'm going to turn it over to my young colleague in City Hall and Citizen Services, Nicole Brown.
Welcome everybody to our community engagement and block chat. I do have a few new announcements for you guys, so I'm going to share my screen. Let me know when you guys can see it.
It is on.
Perfect. Okay, so and by way of eviction prevention, we now have Stand Up Buffalo. And so the city of Buffalo has financial assistance to assist those who meet the eligibility requirements. So you can still call 211 to learn more and apply for this program today, or go to standupbuffalo.com. Tenants and landlords, sign up today for the City of Buffalo's free apartment building recycling program. So this is going to help us keep the city clean and green. You can visit buffalorecycles.gov /apartments or call the number listed on the screen for more information. Child with autism signs has been added to the list of roadway caution signs. So if you are a parent or guardian or know someone who is of a child with autism, please share this with them. And you can apply for this road sign to warn the motorists in your neighborhood. For this sign, you can call 311 or visit the city website at buffalony.gov. Buffalo announcements are still going out. So obviously we're having snow events. So now is extremely important for the parking updates. So you can join the Buffalo by texting join parking updates to 30890 if you specifically want to receive the parking updates. And you'll receive text messages or phone call 24 hours before the restrictions needed for snow maintenance. So just really important to be able to be part of this initiative so you're continually updated. The mayor hosts his Talk of the Town every Sunday at 1 p.m. So coming up on January 23rd. And you can catch us on Facebook, on his Facebook, or on WUFO on Power 96.5. So this week we are lighting up in blue for the celebration of the Buffalo Bills as they face the Kansas City Chiefs. So let's support the Bills. Obviously the city is doing so. You can see us all in our city, our Buffalo Bills gear. So that's something to look forward to this weekend. And Oz, if you want to pop in here, we just want to say thank you to Dixie Fire and GY Ministries for their help. So I'll let Oz give a personal thank you here if you want to interject for a second. You're muted, Oz.
I just again want to say thank you to our existing Good Neighbors Network. We have been doing this from the onset. We do understand about that we had a snow event, and we just want to make sure at 311 we get calls from our most vulnerable residents, our seniors, handicapped and disabled, but those who are vulnerable, and we try to make sure that we can help them in some respect too. And so again, I want to give a big shout out to at least two, and we have more within our network. Dixie Farr, who is the executive director of CEO, Centers for Entrepreneurial Opportunities, and then also GYC Ministry, Reverend Newkirk, and there's quite a few of those there. These are just some of the examples that we have been helping out. It's my understanding that there's a bigger network. There's a lot of people who are doing work here. It's really all about Buffalo. Helping people has no ideology, or we just help and we just do. And so again, I just want to say thank you for helping, and to the extent that from our 311 and making sure that what is making people connected, that's what we want to be able to do. Let's be safe out there. It's going to be cold. That snow is impacted, and so I'm told that the temperature is going to get just a tad bit warmer, so we might be able to make some more headway this weekend. Again, thank you very much.
Thank you, Oz. So we are also accepting applications for AmeriCorps Vistas. So if you know somebody who would like to become a Vista or is interested, please just send us an email at this time, and we'll be opening up the official application shortly. You can email me or Director Mestry. We are having the Crime Prevention Tree Planting Initiative happening this year on both the east and west side of Buffalo in the spring and the fall. For more information, you can contact the Special Project Manager for Crime Prevention for the City of Buffalo, Mr. Ron Dixon, at his email on screen, and he can drop us in the chat box as well. So there are lifeguards wanted in Buffalo. You can register for this program. So this did start January 8th, runs through March 5th. So you can reach out to see if you can still participate. Attendance is mandatory, and you can apply at buffalopal.com. So if you're having trouble coping, or someone we're here to help the Buffalo residents in crisis. The Buffalo Police Department behavioral health team is working in collaboration with Endeavor Health Services to provide on-site screening, assessment, de-escalation, and diversion for people in need of mental health or substance use treatment services. So you can request this crisis intervention team. And if you need more information, guidance, or assistance, you can call the number listed on your screen. So there is a day of service community cleanup. So this was happening this past week, but it was rescheduled to Saturday, January 29th in the morning, 8:45 to 10 a.m., sponsored through the Michigan Street African American Heritage Corridor and Citizen Services. And so we just encourage everyone to come out for a day of service, and you can register at michiganstreetbuffalo.org/MLK Day. And you will also find this flyer on our Facebook. So the Olmsted Community Alliance is having their first quarter meetings in the various districts. And so these are to just help build representation for the for every Olmsted Park district and get the community involved. So you can find this website on the Board of Block Clubs site, Facebook site, and you can attend via Zoom by visiting bfloparks.org and registering for the particular Zoom you would like to attend. If you are looking to start a block club, you can contact the City of Buffalo and Erie County Board of Block Clubs at bocbbuffalo@gmail or on Facebook and Instagram. They're very responsive and will give you the steps in starting a block club. Additionally, they are having their first Zoom meeting of the year on January 27th, 6:30 p.m. with a presentation by Evans Bank. Again, if you need the link, you can email them or visit them on Facebook, and this will be on Zoom, so the meeting ID and passcode is provided. The Buffalo Parent Center presents the Nurturing Fathers program Mondays and Wednesdays. This starts in February, runs through March, 5 to 7. So this is free, offered virtually and in person, and helps with parenting skills, healthy family relationships, and child development. So you can register using the QR code below or contact Terry CA at the number provided, or visit the Buffalo Prenatal and Perinatal Network to find out more and register there as well. And there is a FAFSA workshop being offered on the 3rd of February at Mount Olive Church. And if you are interested or know anybody who might need this, you can find out more for high school seniors and college-bound adults and by registering via Zoom for this event. So obviously, as we know, it's been very cold. This weekend it's supposed to be extremely cold. We just want to share some tips to beat the cold and the wind chill. So preventing frostbite and hypothermia, wearing the necessary, winter attire and dressing in layers is very important, especially if you're going to be outside. And then just some tips for using space heaters and fireplaces to prevent fires and anything else that could harm you during this time. So these are also going to be available on our website and on the Board of Block Club's website. Northland Workforce Training Center is still offering hands-on training opportunities in those different areas, as well as services will still be provided, career coaching, financial aid, substance abuse counseling, and more. You can still go on northlandwtc.org and apply for those, or you can call their phone number alternatively and somebody will assist you. And there is a free self-paced digital leadership program offered through the Westside Promise Neighborhood Change Leadership Program. This is smartphone accessible. It starts in March, runs through March, and you just have to apply by January 24th. And you can be 18 years old and just have an interest in leadership and community engagement. As we know, COVID is still here, very important. So we're offering information on COVID-19 testing. You can find the nearest closest testing site, as well as information on vaccinations and more. Whatever you're looking for should be available on the covid19.buffalony.gov site. And as well as if you are looking for emotional support, you can look at the Buffalo Urban League New York Project Hope for that. So you can contact them by calling the emotional support helpline at that number, and it runs Monday through Saturday, 8 to 7 p.m. Or you can email them at the email listed there, and it is free, anonymous, and confidential as always. So lastly, we do have social media to follow. We just want to share this with you guys as a lot of flyers and events go up on these sites. So the Division of Citizen Services, our Facebook is at Buffalo Citizen Services. And our Instagram is at Buffalo 311. You can also look at our 311 Call and Response Center, which provides timely information for different things happening at Buffalo 311, as well as you can follow the mayor at Mayor Byron Brown on his Facebook, which is at Mayor Byron Brown, or his Instagram, Mayor Byron Brown 716, for city information as well. And I'm going to turn it back over to you, Oz.
Nicole, thank you. A lot of great information out there. We will endeavor to get this information out, put it on our Facebook, and I know it is also on the Facebook of Citizen Services as well. So it's just really, really important that we adhere to that. Let me introduce our speaker because I know he has quite a bit that he would like to share. He is no stranger to our block chat. We want to welcome him back. Dr. Dennis, I want to say I said it right before, Dr. Dennis Coe, right? Coe.
It's quo, like status quo. That's all good.
Status quo. Okay, good. And so the topic that he's going to be speaking about here is addressing COVID-19. All of the COVID variants, protections, multi-generational households, and other COVID-related type of activities. Doc, he's the associate professor at the University of Buffalo. He's the chief of division of general pediatrics at UB. MD Pediatrics, interim chief of the Division of Development and Pediatrics and Rehabilitation. It is my pleasure. Doctor, the floor is yours.
Thank you. No, thanks again. Always a pleasure. And I do wear a lot of hats. I do want to make sure that I'm speaking as an individual physician who does happen to work for a number of organizations within the community. But I also do have a fair number of connections with some of the kind of the thoughts and information about kind of what's really going on. I actually want to talk a bit about what we as a community have done correctly. Yeah, because I think that it's been a tough couple of months with this new variant, with the Omicron variant, and there's been a lot of news that have not been not been cheerful, but I actually think we as a community have done a number of things well, and I actually want to just take a few minutes and highlight that. The coronavirus variant that's known as Omicron has probably been, in all likelihood, it was here since the end of November, early December, and even though it took until the third week of December for it to show up in laboratory testing. Those laboratory sequences were actually taken at the first week of December. So it was here by the beginning of December. It probably was here even a week before. What we saw throughout Western New York and throughout the country followed what we saw in South Africa, in Southern Africa, and in Europe, where there's been spikes of this variant, which is that the virus itself appears, compared to previous variants that have circulated, to cause more frequent infections, probably both mild symptomatic and asymptomatic, but less severe on the whole. That doesn't mean that there is no severe disease out there. Obviously, there is. And when you have even a smaller percentage of severe disease, meaning somebody that has to be hospitalized, even if you have a smaller percentage, when a lot of people get sick at once, you're going to have a rush in the hospitals for a period of time. And that's right where we're in the middle of right now. That said, I can tell you that the hospitals have pretty much held, the healthcare system is held. And I think we need, as a community, to recognize that we actually did a really amazing job at holding it. And I think New York State itself has done a really, really good job of just containing as much as we can. What I mean by that is that the vaccines, including supporting our healthcare workers, supporting our businesses, but supporting vaccinations, and we do have a higher vaccination rate than a lot of the country. The masking, the county's mask mandate, and from that was actually issued before anybody else thought about a mask mandate back in November. Now, that was actually not in response to the Omicron variant. That was in response to the Delta variant, which was circulating throughout the fall. But the fact is that our communities, and our representatives and our government came together and said, you've got a lot of virus out there. We've got to protect ourselves as a community. And a lot of people were going to get sick. Most were not going to get very sick. Some were going to get very, very, very sick. And but of all else, we have to protect our communities, and we have to protect our healthcare workers and societies. And I can tell you that it's been holding. And I can tell you that the cases for the Omicron variant are actually on the downswing right now. And I really firmly believe it's because we as a community really did a lot of things right. Our schools, with a few exceptions due to staffing at the worst caseloads, our schools never closed. Our hospitals are not diverting patients. Like some of the adult hospitals they're full, and there are some long ER wait times, but everybody's getting what they need. We have had some staffing challenges. There are some, agency workers that have gone into the hospitals. The Children's Hospital is 30% empty right now. It's 30% below capacity. And along with all of that, we had a spike in flu in December, and the flu rates have come down in January. So we have actually done a really amazing job as a community at holding it back. And I think we need to recognize that. And I applaud all of you and all of us for making that happen. I want to recognize that there are kids and adults, and there are individuals who have gotten sick from this virus. Some have entered the ICUs, some have passed away, but I do want to recognize just how much we've done to try to mitigate this as much as possible. And my prayers and my thoughts are with those that have suffered from the virus, because I don't want to see that either. But we really have done an amazing job at containing it. Where we are right now is we had a massive, massive spike in diagnosed cases. Some of it is because we're looking for it, and the testing is far more widely available. What we found in the last part of December is that getting tested through the PCR, getting from a laboratory, getting the PCR testing, because so many people wanted their testing, and for rightly so, when the cases of the Omicron variant really started going through the roof, those tests were getting harder and harder to come by. I'm fully aware that even though they were available, and I applaud our county health partners at making them available, I'm fully aware that there are places where people went where the test would take 3-4 days to come back. And I've always encouraged folks to try to go to some of our testing partners, and the county has really done a great job at turning it around. But the testing overload has been an issue. And so as the state and the county have made more rapid tests available, many of which you could do at home, what that does is it makes the testing more accessible and more convenient, but you do trade off a little bit of accuracy. And the accuracy part is that if the test is positive, it's generally regarded as positive. But if it's negative, if you have symptoms, it may not actually be a real negative. So we call that a false negative. And so there's a bit of a trade-off going on there. You trade off some diagnostic capability when you make the test more accessible. But those home tests do have a place. And the best use of it, in my opinion, is that if you're symptomatic and you're worried about having COVID, those home tests can be useful. However, those home tests have been known to not necessarily be positive and accurately positive in the first few days of symptoms. So you need to make sure that if you're still wondering about it, you need to take precautions and make sure that you're quarantined when you have symptoms. And if you continue to test negative, and you have a known contact, you probably still want to isolate yourself until you are actually fully symptom-free. Where we are in the numbers is I was asked to try to give some impressions about, do we know how this is affecting Buffalo and the neighborhoods in Buffalo versus any other place in the county? The answer is you really can't. I mean, the numbers are so high right now. And I think these numbers are also an undercount because they may or may not count the home tests, because the home tests that are reported to the county and the state depend entirely on self-report. We also know that these case positive rates, back in as recently as the fall, like in November, we were talking about 3, 5, 7% case positive rates were considered high, and that was a sense that we were doing enough testing. But by the time late December, the test positive rate as reported by the county was in the 24 to 25% range. And that was with daily cases that previously never really got above about 5 to 700, maybe got up to 8 to 900 in the worst of the Delta phase. But our Omicron variant case reports were totaling in the 2,000 range with a 25% case positive rate. So this virus was so widespread and so far, and we just can't keep up with the testing requirements, that the best conclusion was that this virus is pretty much everywhere, like everywhere and everything and everywhere. And it was a matter of you were either going to get it or you were going to encounter it. And if you were lucky enough to be immune to it, greatly helped by the possibility that you were vaccinated and boosted, you were going to encounter this virus no matter what you did. I will also say, however, that when we looked at our outbreaks in the hospital and in the workplace, whenever we saw outbreaks, they were pretty much when people broke protocols. Otherwise, people taking off their mask and eating 3 feet away for a sustained period of time, or people just not following the masking requirements within the workplace. We did not see any evidence of this kind of outbreak in the school setting, for example. And when I talked with folks at the county, what we're finding is that this is pretty much spread through the community, through household spread, through small gathering spreads, and that's how contagious it was. When you wear your mask and your protocols and you distance, we pretty much could slow this thing down. But you can't do it at home. You take care of your families. You got to do what you got to do. And I've told parents that you have a 4-year-old who's sick. I'm not going to tell you to put that kid in his or her room, for 5 to 10 days. That's just not that they need their mom. They need their dad. They need their parents. They need their family. So, there's that balance you got to run. But I do want to reassure just really kind of the following take-home points, and I'd be happy to take questions because I'm sure that there will be questions and discussion. Number one point is that we just went through a massive outbreak. We have the testing to be able to look at the outbreak. We had a lot of cases. It's probably way underdiagnosed. We are absolutely on the downside of it. Absolutely on the downside of it. My feeling is that this virus has been going down since about the first week of January. The cases don't reflect that until the second week of January. The hospitalizations are not going to start to go down until the third to fourth week of January. What you're finding, however, is that the cases peaked in Erie County on the first week of January and started to go down last week very slowly. But that is reflected in the last report from the county where they said there was a 16% drop in the second week of January compared to the week before. The test positive rate for the county has come down. It was in the mid 20% range. It's now in the 16 to 17% range. The New York City is actually down around 8% now, and New York City is ahead of us, and I think that's where we're going. It has really gone down in New York City, and it is going down here. The second point I want to make sure that folks know is that the hospitals have held. It's been strained. It's been very strained. It's been very busy. There are outside agency workers that are helping, but they've been holding, and the staffing in the hospital is a lot better. It was probably at its worst straining wise in the beginning, at the end of December and the first week of January, and then it started to get better. I presume that we will hear that in the workplace that it has started to get better as well around the county. So I think that we can take a sigh of relief. And I do think that in the healthcare system that it is getting better. There are still a lot of people in the hospital. The county has pointed out that the number of people in the intensive care units has actually stayed relatively steady throughout the whole thing. And so what that means is that there's a lot of people who are coming to the hospital, and even though the cases are through the roof, a lot of them are being diagnosed incidentally. And that range is probably between 30 and 50% of cases. People just showing up to the hospital for some other reason, and they just happen to test positive. So I think that is reassuring for us. The third thing is that when I look at the rest of the country, there are stories and there are examples of hospitals being completely overrun, people transferring, hospitals. I have a lot of family in Mississippi, and one of my wife's cousins is a doctor at a small hospital in rural Mississippi, small town Mississippi, and he was featured in an article that I received where he's having to deal with sending patients 10 hours away again. We're not doing that. My heart and my prayers go to him and our family and our friends in Mississippi, because that's not something anybody should be dealing with. But I do want us to know that I think where we are today, we are on the backside of the Omicron surge, is due to a lot of tremendous work that we as a community did. And my recommendation for all of us is to make sure that we know that we did everything we could, and we needed to, and we need to keep doing it, because that's how we're going to get through the rest of this wave and the next wave whenever that comes. The vaccines are available. They're safe. I would recommend them to everybody, including the boosters. I would test yourselves early and often if you have symptoms, if you have high-risk situations. You just need to know what the limitations of the tests are, but they do help. If you're sick, stay at home. If you're well and you come in contact with somebody with COVID, please make sure that you follow all applicable quarantining and isolating rules. If you were vaccinated and boosted in particular, there is no quarantining recommendation unless you have symptoms, in which case you isolate because of symptoms. We will get through this. I do want folks to take a breathe a sigh of relief that we're on the other side. It's not over. There's still a lot of people who are sick, and it's still being transmitted out there. So, but, masking, distancing, staying home when you're sick, getting the vaccine, they work. They absolutely, absolutely work. And we just got to keep going. So I'm going to stop. I assume there's going to be questions, and I'd be happy to discuss them.
Yes.
Doctor, thank you very much. There is a quick question that we have from my good friend. Is that Jackie?
Yep, who's Jackie?
Hey, Jackie, how are you? So we do have a quick question.
Yes, my grand. And she was at school.
Did we lose Jackie?
And she's come home.
So Jackie,
positive with the virus, and she really had a tough time the last week. Yeah, and my shots plus the booster. How long does this last? That's what I'm concerned about.
so I think Jackie's question was regarding the booster. So if you could speak about the booster. Jackie, you were coming in and out a little bit, but I think your question was around the booster and its effects, or, getting it, not getting it, or.
My granddaughter has the virus. Even though she had her shots, I've had all my shots plus the booster. How long is my granddaughter contagious that lives with me?
Good.
Okay. Okay, so the question is, how long is your granddaughter contagious? I would look at how long my question is she free of symptoms, or is she still showing symptoms like a cough and a runny nose?
Yes.
Okay. The official word on this virus is that you're most contagious between kind of like 2 days before you come down with symptoms and 3 days after you have symptoms. And then even though you can continue to be contagious after that, it really goes down. Passing this virus along once you get to 5 to 6 days is pretty rare. In fact, there are some studies which show that you don't really pass it around. It's very hard to pass it around. Once you get to 6 days after coming down to symptoms, that is pretty hard to pass around. It does happen, but it's pretty rare. So the worst of it, as far as being contagious, is it's 2 days before and 3 days after you come down with symptoms. Once you get to about day 6 or 7, it's really not very contagious. My recommendation is that if she's past 5 days of symptoms and the symptoms are getting better, I would say she's not contagious once she's symptom free. That said, what also makes somebody contagious is whether there's also other precautions, and that include other person has been vaccinated, because that does reduce your chances of getting it from somebody who's contagious. It also helps to make sure that there's space, the ventilation. It's really cold out right now, so I mean, opening windows is really not really practical right now. But those are other things that you would keep in mind. Somebody who is vaccinated and boosted can still get sick from coronavirus. It's just that it's less common. It's thought that the vaccine is still about 70% protective. But to me, that also means that 30% of people will get sick, with some kind of an illness. And when 70, 80, 85% of the population has had some level of immunization, that still means that a lot of people will come down with some sort of symptoms with Omicron because it is so widespread. But I do want to reassure that the numbers also show very, very strongly that when you are vaccinated, you have something like a 15 to 30% times less chance of getting sick and an even lower chance of being hospitalized. So if you're vaccinated, there's no guarantee you're going to get sick. But even if you do, it should be relatively mild. The answer to the original question was, once you get past 5 days, you're not really very contagious at all. And if you have no symptoms at 5 days, I wouldn't consider you contagious.
Anybody else?
So I do have a quick question. So I know a couple people who, after they had COVID, went to the doctor and they said that they had ended up with COVID crystals in their lungs. So I'm just wondering, if you get COVID, should you automatically get your lungs and or your heart checked no matter what, or only if you are still having like a cough, like residually, or what is the criteria, I guess, to continually check your lungs and heart?
Yeah, no, it's a good question. I would go by symptoms. If we're talking about the younger folks, because my area is pediatrics, for example, although in the younger kids, we don't, as a rule, we're seeing very little residual pulmonary disease, but we are seeing, we have protocols to check for heart symptoms. Like if you have anything more than a mild case of COVID, like if you had fever in pediatrics, if you had fever for more than 4 days, or if you were fatigued past and having symptoms past a week, you need to get clear. We say you have to get cleared by your doctor before you can go back to gym or physical activity. So what that tells you is that I would look at that based on how long you were sick and how you feel when you get better. The longer you're sick, the more you consider just getting that checked out with your doctor. That said, when you're talking about the ground glass and lung scans, for example, we know that there were X-ray and CT scan findings that may not necessarily correlate with symptoms and vice versa. So I would always go with your symptoms and how you're doing. And if you have any question, I would have a lower threshold for getting it checked out with your doctor if you were sick for like more than 5 to 7 days without getting better. Definitely if you're hospitalized, because those are the populations, those that are hospitalized are at higher risk for having long-term effects.
Thank you. There was a question. I don't know if we got to it. It was in the chat. It says, "Do you
I saw,
think that?"
yeah.
Oh, you saw it? Did you answer that? I'm sorry.
Okay. Do we think we will get back to a state of normal? Is wearing masks a new normal? I think we'll get to a state of normal, but let me make sure that I'm clear what normal is. The mask, I really think there will be a point where the mask will go away. As a recommendation, as a public health recommendation. The reason it did not go away this spring and this fall, and as we learn more and more about this virus, is that we still had a lot of people who were not vaccinated, fully vaccinated, or not eligible for a vaccine. I also would say that we had a lot of people who didn't fully encounter this virus because of the isolation. I mean, we look at what we did with our school kids last year, and this year the schools are open, and the vast majority of kids have gone back to school. At this point with the Omicron variant, we know that pretty much everybody's gotten it or has encountered it. With the previous waves, and that includes Delta, and that includes all the other, Alpha, we never really had a period in this country where it was totally quiet. So we knew that we had places in this country which was showing us that it was still tearing through the country and causing, large numbers of hospitalizations. We were very, very quiet in the beginning of the summer, and then it started to go up during the summer. And the Delta variant was rampaging through the South. And that eventually did come up here, by August, September, we started to see it. And my belief is that the vaccines and the masking is what held it back to the point where we managed to, where we managed to kind of keep things under control. But once this all really calms down everywhere in the country, I think that's when the discussion for taking the mask off, including in the schools, starts to come around. I think we have to see what happens in the spring, but historically, it usually takes a couple of years for these new pandemic viruses to really burn themselves out and mutate to forms that are not landing people in the hospitals, that start to overrun the hospitals. And I think we also recognize that our hospitals and our healthcare workers are pretty tired right now. We've had people that have left the workforce because they were just tired. And I think once that recovers and the numbers and we know that it's calm around the country, is when we will start to see, the normal come back. I honestly think it's almost there. I'm not hearing of another variant. Like, we knew Omicron was coming. We knew it was coming, and we knew that we needed to protect ourselves against it. But I'm actually not hearing of anything. Once Omicron's gone, I'm not hearing another variant that's about to come in and do the same thing. So, let's keep our hopes up for the spring. The question for if symptoms stays longer than 7 to 10 days, I would recommend you talk to your doctor about that. I think there's a lot of variables about what could be causing the cough for that long. For example, if you have a cough, if I have an 8-year-old and they have a cough, and they have and they catch COVID, and they get a cold, and they don't have a fever, and they're still coughing in 7 to 10 days, and the kids had asthma, I'd say it's an asthma attack. So, and I know that could be the case with somebody who's 40 years old. So I would definitely say, if you're coughing in 7 to 10 days, you should go talk to your doctor about that. And I would let you and your doctor decide what the next step is.
Good. Doctor, I want to say thank you very much. Every time you come in on our block chat, there's more and more great information that our neighborhood groups and organizations, our block clubs have, and we believe in equipping people with the right information as opposed to not having it, and you have presented that today. I want to say thank you very much on behalf of our block chat. I know you're busy, and so taking an hour out of your day on a Friday can always be challenging, but the fact that giving into this community and letting us know, I just want to say thank you.
My pleasure. Thank you for the opportunity, and let's keep it going.
Okay, well, definitely will. Good. Hey, Debbie, I see you, my good friend. Good things are happening on your end. I know you guys got some meetings. I just wanted to give you, this opportunity of kind of sharing and talking. If y'all don't know about the Border Block Clubs, y'all got to get to know the Border Block Clubs. What's going on, Debbie?
Hey, everybody. How are you? First and foremost, last week, congratulations. Great block chat. If anybody's on the call that won the award, congratulations to each and every one of you. Second of all, this also was a great opportunity to hear some wonderful information and hopefully put a little bit of stuff a little bit of relief there. I'm not sure. For me, the jury's still out. So, but is the Board of Block Clubs, I want to say a special thank you, if anybody on here is from a block club, for the way you guys all came through and helped your neighborhood. There was a lot of block clubs that reached out, and I got messages that they just banded together and did what they had to do, even though it was a struggle. So that's what block clubs do. We help one another, we get together, we pull our weight, and we do what we can for our neighborhood. So kudos to all of you that did that. It was really great to see and hear. So that's awesome. Yes, we are going to be meeting via Zoom. Thank you, Dr. Cortasia Carter-Solomon, for setting that up for us. I see some of our team is on the call today, Ellen and Ada. So hello, everybody. And it's going to be a good meeting. We do have a speaker, but we are also leaving it open-ended so that we can talk to our block clubs and see what's going on. If you have any issues or concerns, please bring it to the meeting, and we will do our best to get you connected with the powers that be that can help with those issues or concerns. I know our staff from Citizen Services will be on the call, and anything new and exciting coming up, they're going to share with us, as they always do. We have a great working relationship with them. So it's a fun time. It's a little cold out today. It's going to be cold this weekend, but that's okay because we're going to be pumped up for the Bills, and nobody's going to care about the cold because we're going to be all nice and warm and toasty and doing our thing and rooting them on. As always, it's an honor and a privilege to be on this call. I really, truly appreciate you guys giving me this opportunity and to talk about just things in the community and what we can do and different programs and agencies that are out there. So Oz, thank you so much for that. And to my team, as always, you guys are like the bomb. And that's really it for right now. Hopefully next block chat after our meeting, we'll have a lot more to talk about. And we're going to get things rocking and rolling for 2022. So watch out because we're coming full force.
Good. Debbie, thank you very much. You've been a treasured partner. I know one thing. At our next block chat, I'm going to make this announcement. Everybody should be wearing some kind of Buffalo Bills gear. That's because I know we're going to win, right? And before we leave, if you could put it in the chat, tell me who your favorite Buffalo Bills player is. You can put the number, the name. I just need to know, because I'm wearing number 14 here, but, let me know what's up. Again, let's be careful out there. Again, what we did this week was during the snow, we activated the Good Neighbors Network. So if there's a block club or community-based organization that a vulnerable senior, somebody who's handicapped or disabled, make sure if they contact 31, if they contact Mike. Again, we have some limited volunteers. We showed you pictures out there that they've been going out there and helping people. Please do in that respect too. So again, let's be safe. And there's resources out there for everybody. Look at that. Stefan Diggs, Andre Reed, I said, Trey, Lynch, old school. Oh no. Oh, and it's Allen. Okay, I got you. Listen, go Buffalo Bills, and we'll see you a little later on. We are giving you back 6 minutes of your day from our block chat. Take care. Take care.
Bye, everybody. Have a great weekend.
Bye-bye.
Go Bills.
Go Bills.
Go Bills.
Hi, Jackie.
Mo.
Yes.
Like, for real?
To meet you as that an intern opportunity. You just reached out.
Yes.
Okay. Can I send her in or?
He knows.
What happened?
It's fine.
Oh, okay. Okay, got you.
Oh, we got it. I'm about to get off.
Okay.
Or you're gonna get? Well, yeah, we can get off. Thank you very much, guys. Take care.